regard her as seconds. I'm first and she's a second.
Yes,
And
she is.
she put that set on the go. Can you see it in the past?
Yes.
That she built that.
Okay,
I've
so
known her
my
for
name's
years.
Nicky, and this is my father, John. It was about nearly 2 years ago now. My father, he was looking after himself with me coming in occasionally, and then he had a nasty fall and he ended up in hospital. So we were very fortunate to find Zanta Healthcare, but the company we had for about a week when he came out of hospital, it was very hit and miss. But so before he had the care, he was kind of doing his own meals, but I don't think he was heating them up properly. He wasn't really looking after himself that well, and we didn't realise sort of how bad he had got. But then once Zanta became involved, they started coming in doing his breakfast, his lunch, so he has a sandwich, and then heating up his ready meals, controlling his medication as well, because he started taking it in the morning and in the evening when he should have only been having it in the morning. So he suddenly started, to get so much better and happier, and he was dead against having people coming in and helping him, but now they're like part of the family. It sort of means now I don't have to worry so much, in the day. I know that safety-wise that there's always someone checking on him every so many hours, what have you. So it's sort of a big relief for me knowing that someone is coming in first thing in the morning and they're helping him. They give him his independence and still try and encourage him to do the things himself, like dressing himself and things like that. But I know that he's, and they ensure his safety with his walking stick, making sure he's always got it. So it's a big relief for me that I can carry on working, and know that he's safe. And I still come up in the evenings, but it relieves the pressure a lot. If I'm worried about something, straight away I contact Martha, the manager, and she always, sorts out. If Dad's, one day he had a fall, and she always comes herself, makes time during that day to come and check that he's okay, and she, comes and checks out even the next day. She's very good, and I leave notes for them. I leave a lot of notes. I think I'll probably drive them mad, but we've got a good system going, and then they'll leave me a little note back, if there's something I'm worried about or they're worried about, could you look at this? And it's really good. I'm very lucky that I've got a supportive family, so yeah, my children come along and my husband, and so occasionally, if I can't come up to my father later on in the evening, they will come and they help out, and it's really good. And there's still great communication, with the company, and they know all my family, so it's really good. And if there's a problem, they're just they're always there.
Don't forget, they came in, you went out somewhere, they came into this room, and she played music.
That's right, she played the piano, didn't she? Yeah. That's your granddaughter, isn't it?
Yeah.
Your granddaughter, Lauren, she came and played the music, Yeah.
And what about
and Sam,
the brother?
Yeah, and the
as
brother,
well. He came with her.
Yeah.
And while they all went somewhere else.
Yeah. I would fully recommend getting in touch with them, because it just makes your life so much easier, and your parents really take to them, and it really helps them living a everyday life and carrying on with their life safely, and being happy as well in their own environment. That is the main thing, because Dad's wishes are he wants to be at home. He hates going to hospitals and anywhere else. So I would fully recommend to anyone, don't be frightened, even if they say they don't want the help, please
When I was
try
little-
and take it up because it's brilliant. You know, we've never looked back since. You know, fantastic service, and can't thank them enough for everything they've done.
I thought I saw something there.
Yeah, no, you're all right. Okay.
Okay.
So I'm going to go.
Yes, and it's lovely to see you. Okay.
Thank you. You
All
take
right.
care.
You are extra special.
Thank you.
Okay.